So hi, I'm Jen from Clue, and thank you for the invite to speak here. I was really happy to see the event description saying people who menstruate, because that is my personal crusade. We're going to hear more about that later, but I wanted to start with a video to explain some more of the things we're doing at Clue this year.
It's 2018.
Okay, great.
More than 2 billion people own a smartphone and have access to thousands of years of accumulated human knowledge. Yet one thing continues to be a mystery, a taboo. Every month, more than 90,000 people type the words, "Am I pregnant?" into a search engine. Sex education was introduced in the US after World War I, when many soldiers contracted sexually transmitted infections. But many countries still don't have any coordinated sex education programs. And in the US, 37 states require that students be taught about abstinence. But teaching teens not to have sex until marriage hasn't proven to be very effective in preventing STIs in pregnancy. Cases of sexually transmitted infections have been steadily rising since the 2000s, with at least half occurring in young people between the ages of 15 to 24. I remember my sex ed class in 9th grade. My phys ed teacher put a condom on a banana. I've heard that some people still have to take a sack of flour around for a week and pretend it's a baby. But even if we're lucky enough to be taught the basics of contraception, what about everything else? When will I get my first period? Can you get pregnant on your period? When do you ovulate? Is vaginal discharge normal? And what about all other stuff related to the cycle that we're never taught about? Why do we get tender breasts or back pain, headaches, acne? It's 2018, and we can finally say the word period without embarrassment. There's a lot happening. We've come so far. But the menstrual cycle isn't just your period. It's a vital sign, like your pulse or body temperature, and it affects everything from your sleep to bone density and even heart health. I didn't know that. Most people I know don't know that. Why? Because talking about hormones is still really taboo. Reproductive health just isn't treated with the same seriousness as other aspects of health. Why did I have to learn about cell mitosis, but never about my own body fluids? When we know how our bodies work, we can make better choices. We've got so much left to do. It's 2018.
So that gives you a bit of an idea. For those of you who don't know Clue already, we started out as an app. We're still an app and we have new features coming. And the idea is that you can track your personal menstrual cycle and different symptoms that you have. And you can see predictions of when your ovulation is going to come, when your period's going to be due. And you can also look at patterns, maybe energy levels across the cycle, or your skin or hair, pain, all different things. That's a whole nother presentation. The point is, Clue can help you know your body better and understand maybe, oh, is that thing related to my menstrual cycle, or am I just having a crappy day or something? Or is the world just making me angry? Who knows? But Clue can help you to see the patterns and what is cyclical. So 10 million people are using Clue every month, and in 198 countries. For the moment, we're just publishing information in English, but we have 15 languages in the app, and we're going to localize that more. So our content is reaching millions of people. The website that you've just seen the video about, we send out a newsletter and through our social media. And I started at Clue working in the customer support, answering hundreds of questions like this. Why is my period late? Am I pregnant? Am I normal kind of questions? And also questions like, oh, I'm taking testosterone. Is that going to affect my period? Or I get gender dysphoria. How can I deal with this? When I get my period, it really reminds me. And brings up all these things when the menstruation products are so gendered, and illnesses like endometriosis, for example, are really gendered. So it can make it hard for people that don't see themselves as a woman to get access to information and healthcare. So I started writing for the website, and general health questions, sex education stuff, trying not to make any assumptions about people's gender or sexuality. And then more specific things about testosterone, about finding a doctor who's trans-friendly, dysphoria, like I mentioned before, endometriosis, and like hundreds of other things. And also, something that keeps on coming up is the language that we're using, and how can we make this accessible for everyone, while many people sort of understand it as a women's health thing, that we need to reach out to women and girls as well, but we don't want to close anyone out of the conversation. By the way, I just want to give a shout out, all these beautiful illustrations. Marta's here, who does most of them, and they're a big part of the website. Also, Nicole Telfer is one of our fact checkers, science fact checkers. So when I write all these things, she's the one who makes sure it's really scientifically accurate. And yes, so it feels really good when people do reach out to us and say, hey, they see what we're doing and they like it, because it gives me a headache, honestly, sometimes, trying to figure out ways to phrase things. I feel like we've gotten it down for a lot of situations, but the one thing that I want your help with is the phrase female health. So how can we say this in a way, we're not just talking about menstrual health or reproductive health, we're talking about a world where sexism and transphobia make it hard for some people to have a good quality of life. And how can we say that in 2 words? So I'll let you think about that, or something short that can fit on an iPhone. So that's where I'm going to leave it today. Thanks for listening, and it's really great to be here.